Hello. Today I'm going to talk to you about complementary and alternative medicine in GI and illnesses. My name is Anthony Lembo, and I'm a professor of medicine at Harvard Medical School and director of the GI Motility and Functional Bowel Disease Center at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. Probably the most commonly used behavioral therapy is known as cognitive behavioral therapy. This is applied to a wide range of mental health and chronic medical conditions. For with regard to IBS, a recent guideline recommendations by the American College of Gastroenterology was given a strong recommendation for improving global IBS symptoms. It's also likely to be helpful in other GI disorders that have stress triggers or where anxiety depression contributes to poor outcome. We know this because anxiety has been known to lower thresholds for pain. We also know depression is associated with increased postprandial distress, nausea, and vomiting. And CBT can improve symptoms of several of these GI disorders while also enhancing the emotional well-being and the quality of life and reducing healthcare needs. So how does it actually work? This is a slide I borrowed from Sarah Ballou, showing us how it works really in a nutshell. We know that our thoughts and behaviors influence our emotions and physical reactions. For example, you're sitting in traffic. This can be quite frustrating. And your thoughts you start thinking, I can't take this commute any longer. I'm going to lose my job if I'm late again. Your reaction is you get quite stressed over this. And so your emotions will start having physical effects on it. Cognitive behavioral can help with the same situation. It can help change your thoughts and belief. You say, this traffic is no fun, but there's nothing I can do about it. At least I'm enjoying listening to this book on tape. And there you'll have less stress and anxiety despite having the same exact event. So cognitive behavioral helps to change your thoughts and behaviors, which can in turn can affect the way your body reacts to it. Now, conventional cognitive behavioral therapy usually has 10 to 12 weekly sessions. Now to go psychoeducation and rationale. This is for the buy-in, to have the patient buy into cognitive behavioral therapy. They do self-monitoring for awareness and insight into their GI issues. And then they start going through cognitive techniques, identifying and changing unhelpful thinking patterns for symptom-related anxiety, catastrophization, and hypervigilance to symptoms. And also behavioral techniques are reviewed, including relaxation training for arousal reduction, problem solving for flexible and emotional focused coping, and exposure to minimize avoidance and safety behavior, as well as self-care skills like diet, exercise, daily routine for general health and well-being. This was an interesting study that was recently conducted by Jeff Lackner at the University of Buffalo. And what he did was compared standard cognitive behavioral therapy to short cognitive behavioral therapy. This is, standard cognitive behavioral therapy to minimal contact cognitive behavioral therapy. These are a large number of patients, and the minimal contact only had 4 sessions compared to the 10 weekly sessions of standard cognitive behavioral therapy. And it also had some home-based CBT requiring homework to be done for the patient as well. And they also had a third arm that was educational control. They had 4 sessions of IBS education. You can see in the graph on the right that this is, if you look at the patient reported outcomes, this is immediately following completion, where the blue is the minimal contact versus the red or orange, which is the standard CBT. And you can see that minimal contact actually did better than did standard CBT, and both of them did significantly better than did the education alone. So this holds promise, and certainly there's been a lot of interest in doing things like CBT and other type of psychological therapies over the internet. Now with the recent advent of Zoom and other platforms, this is becoming more popular, and I'm sure we'll be seeing some studies on the effect of CBT and other treatments using Zoom, no physical contact, but just Zoom for it. So the next thing I want to talk about a little bit is hypnosis. And hypnosis is I think we're all familiar with what hypnosis actually is. And this really is imagery that's given to the patient once they get into this hypnotic state. And this shows you a nice example of a psychologist giving these images of a calm river, having them refocus, so reduce their pain and reduce and heightening their suggestibility. So this is trying to change the patient's thinking, which is instead of a calm river, there's rough water with severe pain, heavy focus on pain, can't cope. And by hypnosis, you can help change some of these thought processes that can be done to help them with their symptoms. And there are a number of trials. This is specific for IBS, but there are other trials in other GI disorders as well. In most of these studies, in these 5 trials from this meta-analysis from a few years ago, that most of the studies showed favorable outcome. It really produced significant results and improved the cardinal symptoms of IBS in the majority of patients, as shown in this graph. You can see that the overall improvement was to the left of this line, which would be no effect at all. You can see that there was a significant effect that seems to be clinically meaningful. So this too would be an option. Now, there are a number of other psychological therapies. This just comes from a recent meta-analysis. We've already talked about the cognitive behavioral therapy, which is shown up top, and hypnotherapy, but I just want to point out there are others that have been studied. So in this case, specifically for IBS, but again, in other GI disorders as well. So thank you very much for your time and appreciate your attending.